Hi, welcome back to my 3-part series centered around getting help for maladaptive daydreaming. This is the third video in the series. So the first video was 5 key signs you're maladaptive daydreaming. The second video was how to get help when you're embarrassed, and I gave 5 tips for reframing maladaptive daydreaming in order to encourage people to be able to talk about this and get help. And this video is, how do we actually stop maladaptive daydreaming and what does help? Therapy, medication, willpower. I've tried all 3 of them, so I'm just going to kind of discuss my experiences and what I've heard from some other people as well. So those first 2 videos, if you've not seen them, I'll leave links for those if you want to check those out as well. So this is really the third stage, I would say. The way I've designed this series is, the first thing you'll be doing is trying to establish that you are maladaptive daydreaming. You've probably recognised that you've got a problem, you'll start to investigate it, and then you'll face the challenge of actually trying to get help for it and try to speak about it, because it is quite an embarrassing problem, and I go more into that in the second video. And now, if you are able to talk about it and reach out, what does actually help maladaptive daydreaming? So I think the important thing to say here is that maladaptive daydreaming is not considered a mental illness by itself. It's considered to be a symptom of other illnesses or other problems, ADHD, depression, OCD. So depending on what your problem is, the solution to maladaptive daydreaming may be different for you depending on what your particular problem is. I'll tell you my story of how I started to look for help for maladaptive daydreaming and what's actually worked for me. So the first time I reached out for help for maladaptive daydreaming, I didn't have that phrase. I wasn't really aware of what I was doing. I just knew that I had an addiction to daydreaming, and I was focused more on the content of that daydreaming. I saw a therapist about this, and she kind of treated it more just like having an obsession or an addiction or an interest in something or someone, and she was looking for reasons about why. I couldn't properly explain the behaviour. I didn't have the term maladaptive daydreaming, so that therapy didn't really help the problem. If you're at the stage where you have the term maladaptive daydreaming, that is like the best thing to be armed with, because you know that there's a problem there, other people suffer with this, and that is like the best way to approach getting help. You're aware that it's a problem and you want support in dealing with it. That's really the best place to be when you go looking for help. The second time I reached out for therapy, I did have the term maladaptive daydreaming, and really all I wanted at that time, I was so isolated, I was so lonely, I just wanted somebody to speak to, and that might be where a lot of people are. So it might be that you are actually not ready to stop maladaptive daydreaming, or you're not really in the place where you need to stop, but you're in the place where you need to tell someone. And I think that's actually the first stage, is you want to just be able to talk about the problem and not necessarily be at that point where you're going to be able to solve the problem, but you just want to get it out of your head, and for it not to be something that only you is aware of that's happening in your life. It's obviously an invisible problem to other people, but it can be all consuming to you. So even just having a therapist that you can talk to about this, or having someone in your life that you can talk to, that can be somewhat helpful. My experience of this is the therapist did advise me at that time it probably was a symptom of another condition, but I wasn't ready to hear that. I didn't want that to be the case, because I didn't want to go to the effort of seeing a psychiatrist or pay the money to see a psychiatrist, or I didn't really want to believe it was a bigger problem. I kind of thought it could be solved by just talking about it. So it ended up being the case that it couldn't be solved by talking about it. In my case, she was just kind of giving me, tips to stay present and exercises in that vein, which you might just give to somebody who is struggling with anxiety, or, struggling to stay in the present moment, or, worries too much. You'll get a lot of tips on how to try to stay in the present moment, to be aware of your surroundings and to focus on your senses. That's quite a common way that people try to deal with maladaptive daydreaming, and that might work for some people and it might work for you, which is great, and you can do that yourself, but it is good to have a therapist or someone who you can talk to about how you're getting on and your progress. So that is where I think, therapy can help if you do feel that techniques for staying present are going to be enough to help you. The third person I saw when I realised, this problem is just so all-consuming, it's not going away. Therapy doesn't help this. Talking about it hasn't helped me. And this is when I eventually saw a psychiatrist. I was then diagnosed with OCD, so that explains that the maladaptive daydream for me is a compulsion, and it's linked to some darker thoughts, and almost the maladaptive daydreaming is kind of saving me from myself in a sense. And that's what's really important, is to understand what happens to your brain when you stop the maladaptive daydreaming. You don't want to stop the maladaptive daydreaming if your response to that is to become incredibly depressed. That's why you might be thinking that maladaptive daydreaming is good for you, because it does stop you from thinking worse thoughts. But why are you thinking the worst thoughts in the first place? That might be the illness, and in my case that is the situation. So finding out that I had OCD and getting treated for that has been the biggest help that I've experienced. I did get prescribed medication, and the medication that I'm taking has been very, very helpful in minimising maladaptive daydreaming and to a large extent stopping it, apart from the occasional time when it comes up. But it really has made a massive difference to my life. I don't want to tout this as being the solution for everyone, because everyone's different and everybody's brain responds differently, and I think everybody seems to have different root causes for their maladaptive daydreaming. So that's why it is really important to speak to somebody and see if you can kind of untangle what it is that's leading you to maladaptive daydreaming. But it does mean we're in a sort of unfortunate situation where there's not a one-size-fits-all solution to this problem, and I think that's why it's quite challenging, and why what I would say is everybody should look for their individual help and try to get help and talk about this and try out medication if therapy doesn't work for you. I would really truly have never thought that medication would have helped me. I couldn't understand that. I couldn't get why medication would stop you daydreaming. I couldn't get my head around. So it just shows we don't really know what's going on in our brain and what makes them behave like this. And obviously psychiatrists and doctors know a lot more than we do, and it is kind of like a miracle. I'm not maladaptive daydreaming, but I'm also not having the negative thoughts that I would have if I was forcing myself to stop maladaptive daydreaming. So for me, medication has been the most effective thing. Therapy is good to stop the isolation. If you have nobody else to speak to, it is really good to have a therapist to stop feeling isolated and to really provide a kind of comfort for you, that you're not alone. I think the hardest thing about this problem is that it's so isolating. It's all going on in your head. It really is invisible to people in your lives. I used to just not understand how can't people see that I'm suffering, but now I understand it's just not visible. And for me, OCD is kind of an anxiety disorder. So if you are in a situation, you are with the people close to you, friends and family, that's when actually you're at your most healthiest. So they tend to see you at your most healthiest, and they don't see, when you kind of go downhill the rest of the time. In terms of willpower, can you stop maladaptive daydreaming through willpower? I think a lot of people have. I've read on forums, a lot of people have been able to stop this, and this again will depend on what the cause of your maladaptive daydreaming is. You might maladaptive daydream as a coping mechanism, as something that you've just, learned to do in order to avoid certain situations. And in that case, if you're able to replace that with something else, and again, I've seen this quite a lot, if people, they take active steps to improve their lives, then they're able to cut down the daydreaming or stop the daydreaming. Now, you shouldn't beat yourself up if you can't do this, because I've always thought, oh, I should be able to save myself, I should be able to do this and do that, and I have, done this and done that, and nothing's been able to help me, and I've not been able to stop through willpower, and this is because I have OCD, and, stopping daydreaming leads to worse issues and leads to, complete depression. So you need to be very careful, and you really need to understand, what are you maladaptive daydreaming for and what's going on in your brain. This is why, if you read other people saying, oh, I was able to do this and that, I just, got some better hobbies, I'm just, meditating, and you kind of feel bad, oh, they've been able to stop it doing that. Yeah, I think you really do have to understand that some people may be able to stop it through that because of the reasons they're maladaptive daydreaming in the first place, but some other people will not be able to stop it through that because there's a bigger underlying issue. So definitely what I would suggest is really thinking about what happens when you stop maladaptive daydreaming, and that is really the place to begin to, I think, understand, if you're becoming incredibly depressed or you want to die when you stop daydreaming, obviously that is not normal, but for me that was normal life. For me it was just such a struggle. I was just seesawing between depression and daydreaming, and I couldn't get myself out of it. It's so difficult to get out of it, actually, because if you stop the daydreaming because you want to get help, but then because you've stopped the daydreaming, you're depressed. Once you're depressed, it's so hard to motivate yourself to do things. So yeah, I would just say really be kind and be gentle to yourself, and really appreciate that this is not a failing of you. There's something going on in your brain, and you should seek out to find out exactly what that is and to understand yourself. I really regret all the time that I've wasted just accepting this was a part of myself. I can't really beat myself up for that because, I really didn't know any different. But, it's a shame I have wasted a lot of years in this kind of mental back and forth between daydreaming and depression, and I really just did accept this as part of myself. And I hope, if you're watching this video, I hope you don't accept that for yourself, and if you are unhappy and you feel that daydreaming's consuming your life, then please do reach out for help. And if you are feeling like that's a struggle to reach out, please do watch the second video in this series, just to kind of talk about how to get help if you do feel embarrassed to speak about it. So yeah, that is the end of my 3-part series for now. These were the main things that I thought I would want to hear when I was first looking into maladaptive daydreaming. So I just wanted to provide a concise introductory experience to people in order to get help. So I hope these videos have been useful. I'll link all 3 of them below, and please do leave any comments and any help, any advice that you can, because if people are on here and they want to get help, then please do provide any encouragement you can as well. So thank you so much for watching these videos. Please do like and subscribe to help other people find them, and I'll see you in the next video. Bye.